Post-renal acute kidney injury. That's what we're talking about today, so stay tuned. We're going to get into it right after this. Hey guys, this is Tammy with NurseMinder, and in today's video we're going to be talking about the third part in a series of acute kidney injury. Now, if you haven't already watched the first two in this series on acute kidney injury, go on back and watch the pre-renal failure, and the second video in this series is intra-renal acute kidney injury. Now, today we're talking about the post-kidney. So we've already covered things above the kidney, in the kidney, and now we're looking at what's happening below the kidney that actually might be causing us troubles. We're going to be looking at three main areas post-renal, after the kidney, that can cause troubles with our urine output and ultimately create more damage if we don't resolve it. So let's get started. Okay, so let's start with the urethra actually, because this is one of the most common causes of post-kidney, post-renal acute kidney injury. And this is specifically for those of you in this population that have a prostate, so males and those of you with male parts. We'll bring it a bit closer. The prostate sits here right underneath the bladder and it wraps around the urethra. And as we age, one of the natural side effects of aging is that the prostate can enlarge. And as it enlarges, what it does is it puts pressure on the urethra, which means that it's closing in that channel and it's becoming narrower and narrower. Some of the signs and symptoms you're going to see in your patients is that they're going to the washroom, but they're having a hard time initiating a stream because this is narrow. They're having a hard time initiating a stream because the urethra is being pushed on and it's creating a really small pathway for urine. And so a hard time initiating, feeling like they can't evacuate the bladder completely, so they're going to the washroom a lot and they just don't feel settled afterwards. There's always this urgency to go to the washroom again. And so that's one of the reasons why we may see decreased urine output in our patients. So there's two things that will cause that prostate to enlarge. One is that it's just idiopathic, meaning it's part of aging. We don't really know why it's enlarging for you. We call that benign prostatic hyperplasia. Hyperplasia just means excessive growth, prostate, and it's benign. The other thing is that it could be a tumor and it could be cancerous. We have a cancer cell growing in there that's also creating enlargement and pushing in on that urethra. Okay, most common cause in males. Working our way up. We're going to look at the bladder next. In terms of the bladder, we can also have a tumor, cancer, inside the bladder that is blocking off either entry of urine in or exit of urine. The second thing we can have is what's called neurogenic bladder. Now, inside the bladder, we have a lot of great nerve cells and receptors that help us know when it's stretching and there's a lot of urine in there that we need to evacuate. When those receptors recognize that the bladder is stretched to the point that we need to go pee, it sends a signal to the brain, and the brain sends a signal back down to the bladder to increase that sense of urgency so you go to the washroom, but also to help relax that sphincter that's preventing the urine from flowing out. A lot of moving parts in urination. In neurogenic bladder, they've lost that signal. And so the bladder is stretching, but there's no signal getting to the brain to tell the bladder you need to go to the washroom. This happens in patients who have had spinal injury. It can happen in patients with multiple sclerosis, Parkinson's, and even diabetes as a result of the nerve ending damage that happens. So what are the signs and symptoms of neurogenic bladder? You may not see any. Your patient isn't triggered to recognize that they have to go pee. So you're going to be wanting to watch how frequently they're going to the washroom or infrequently they're going to the washroom. So as part of your assessment with your patient, when you do your head to toe assessment, you're also evaluating the bladder and you're palpating in that lower abdomen, upper pelvic region to feel if there is firmness and if it looks like it's abstended. Is that the right word, abstended? Okay, no, it's not abstended. I just had to go look it up. Distended. Ugh. Okay, that means there's a lot of stretch in that bladder and you might be able to visually see that or palpate it. Now, the third area we're going to go to is the ureters themselves. Now, one of the common causes in the ureter is kidney stones. This is where we're going to see a blockage of urine, and then we have a lot of pain, first of all. If you've ever had them, you know they will knock you to your knees. Okay? But what's happening is the urine now is having to go back up. And this is called retrograde. And this can lead to excess fluid in the kidney and be a cause of intrarenal failure if it's not resolved quickly. So kidney stones, one cause. The second cause is strictures. And there's a lot of things that can cause strictures. It's the same as in the prostate. There's something that's creating a narrowing of the ureter, and it's reducing the amount of urine that can get through into the bladder and then excreted. Now, the one thing that can affect all of these is trauma. A motor vehicle accident, any abdominal trauma, stabbings, those kind of things that are injuring the anatomical structures of the kidney. Now, those are the three areas that we're going to be focusing our attention on post-renally to help identify the cause of our patient's sudden decrease in urine output. So now the treatment of a post-renal acute kidney injury is really to restore the flow of urine, because we've got all these places where we can have obstruction. Once we identify the underlying cause, we can implement the right treatment. So back to the urethra with an enlarged prostate. If it's cancer, we're going to be looking at radiation, chemotherapy, surgery. And one of the things you'll see ordered for your patients is a catheter. Now, those who have BPH or enlarged prostate have a specialized catheter that we use in order to make sure we can get through that stricture at the urethra. Now, when it comes to treating neurogenic bladder, obviously we need to restore the flow of urine, and we also need to do a bit of preventative work. You may see your patients on a range of medications, including antibiotics to prevent infections or to treat an infection as a result of having that urine sit around too long, as well as catheterization and potentially surgery. Now, treating kidney stones has a lot of options there. It's possible that you'll be able to pass those kidney stones if they're small by drinking some water, taking some medications to relax those ureters so that they're wider so the kidney stone can pass, and pain relievers. Now, if those kidney stones are too large, we're going to do, there's a few options for you. One is a non-invasive procedure using sound waves. And essentially those sound waves, they're very strong. They resonate through your body to your kidney stone and breaks it up into multiple pieces so you can pass them and then go back to drinking water and taking pain medications while you do that. There's also a scope or a surgical procedure to help remove them if they're large. So there may be a few treatment options that you see for your patient. So that is our post-kidney, post-renal, acute kidney injury lesson for today. There are 3 spots to watch: the ureter, the bladder, the urethra. And as long as we identify the right location and get that treatment instituted, we'll be able to correct a post-renal acute kidney injury fairly quickly. Don't forget to subscribe, hit that like button, and share this with your friends, because I'll tell you what, if we don't notice this quick, then we can end up causing far more damage to our patients. So this is why, as nurses and nursing students, checking your urine flow is not just a checkbox at the end of the day. It truly is an important skill to develop and to be mindful of every day. Until next time, make it a great day.